guys, welcome to Southern California EMS Training Institute. Today in this video we're going to be talking about nitroglycerin and how to administer this to a patient. First off, nitroglycerin is a medication that's going to be prescribed to your patient for issues with what we call acute coronary syndrome. Acute coronary syndrome really has to do with things like maybe angina or myocardial infarction or heart attack. These patients will be prescribed this medication, nitroglycerin, to help alleviate their chest pain when they're having cardiac-like chest pain or a chest pain due to some sort of cardiac event or cardiac in nature. So that's what nitroglycerin is for. A little bit about this medication, like I said, it does come in a couple different forms. It comes in a lingual spray or maybe a nitrostat or nitroglycerin tablet. These are little compressed powder form tablets, and this is actually a spray that you're going to spray under the patient's tongue. Both of these medications deliver the same dose of 0.4 milligrams, and it is going to be sublingually under your patient's tongue. Now, we give this medication for a couple different reasons, right? Is it supposed to vasodilate and help open up those blood vessels a little bit more? Because when we're dealing with a cardiac-like event chest pain, typically those coronary arteries are being occluded, right? And we're not getting enough oxygen and nutrients through. So it's going to help vasodilate or open those up a little bit. But what we're really looking for is it's going to decrease how hard your heart has to work, and it's going to decrease how much oxygen your heart actually needs. And so this is really going to benefit this patient, because when those patients have cardiac-like chest pain, it's like, hey, I feel like somebody's sitting on my chest, or it's crushing, it's that pressure radiating to my left arm, neck, or my jaw, right? Typically it's due to their heart muscle not getting enough oxygen. So we're going to help decrease how much oxygen that heart needs by helping decrease how hard it has to work, hopefully again by vasodilating a little bit. Now, our indication for this medication, you guys, is this patient has to be experiencing chest pain, right, of cardiac origin, something that we expect might be cardiac in nature, like a heart attack, or for instance, maybe like angina. Again, this patient can't just be having chest pain. You know, maybe they got hit in the chest by a bat, and they're just like, hey, you know what, I'm having chest pain. This nitroglycerin is not going to help that patient, right? It has to be cardiac in nature. That's why we're going to give them this nitroglycerin. Also have to have approval by medical direction, and we should 6 rights and de-dice our medication before administering it. Now, we do want to be careful with this medication. It comes with a lot of contraindications. Some of the contraindications, right, is number 1 is their heart rate. Heart rate has to be below 100 and above 50. So we need to check a set of vitals before we administer this medication. We should also be looking at the patient's blood pressure. If the patient's blood pressure is below 90 millimeters of mercury systolic, we cannot administer this medication. Also, if we've administered one medication and that patient's systolic blood pressure drops greater than 30 millimeters of mercury before our next dose, we can't administer it again, because it vasodilates, will decrease your patient's blood pressure. So we don't want to bottom out this patient's blood pressure and cause more issues for them. Also, after that, a couple other things is if the patient's taken max dose before we've gotten there, we can't administer this medication. Typically, we look for 3 tablets, right? So if the patient's already taken 3 prior to our arrival, we won't give them an additional 3. We are going to stop. If the patient's taken 1 prior to my arrival, I can assist with 2 more doses of this nitroglycerin. Also, if the patient is an infant or child, typically not a cardiac in nature chest pain, so we're not going to be giving this to them. That shouldn't be prescribed to them either. If the patient has any head injury, suspected head injury, or recent head injury, we don't want to be giving them nitroglycerin. And then also, you guys, if the patient's taking any erectile dysfunction medications in the last 24 or 48 hours, depending on the medication. Erectile dysfunction medications are things like Viagra, Cialis, Levitra, things like that, of that nature. We don't want to administer nitroglycerin to that patient. So there's a couple things about nitroglycerin that we want to know and be looking for before we administer it to our patient. Again, if our patient has any one of those things, we should not be giving them this medication. A couple other things we can check for or just be aware of before we administer this is some side effects, right? This patient might get a little bit of burning underneath their tongue, and they might also feel a headache that comes on after administering this medication. Those are normal, and those can be expected to happen after we administer our nitroglycerin. When we administer this nitroglycerin, we're going to do one of 2 things. Again, we are going to assist with our nitroglycerin for our patient. Hopefully they already know how to take it. We've contacted medical direction. We've done our 6 rights and de-dice. We're going to have them lift up their tongue, and we'll put 1 spray underneath their tongue. and then we're gonna reassess our whole patient, reassess their pain scale, reassess all their vital signs, their blood pressure, their heart rate, and do a full assessment before we think about giving any more. Again, we can give up to, right, 3 doses of 0.4 milligrams. Each spray or each tablet, again, is 0.4 milligrams, and we can administer up to a max of 3 doses. But we want to reassess at least 3 to 5 minutes in between each dose. After 3 or 5 minutes has progressed, I can consider recontacting medical direction and getting approval for a subsequent dose at that point. So again, that's nitroglycerin, guys. That's what we're going to be looking for in any patients with suspected cardiac origin chest pain. And yeah, thank you guys very much for watching.